If we can get an enhancement in the contrast, then we almost get a magnification bump, so it becomes easier for the patient to see even though the size hasn't changed. So let's talk about reduced visual acuity a little bit. So if we have a patient that comes in, say, with macular degeneration, glaucoma, some other kind of condition that's causing a reduction in vision, then we would expect them not to be correctable to 20/20 on the eye chart anymore. When we start talking about the numbers, what's up on the screen right now is 20/70. So once a patient reaches an acuity of 20/70 or worse, then they're considered the low vision category. Once a patient reaches a visual acuity of 2200 or worse, then they're considered to be legally blind by the definition of legal blindness. So this is one of the many factors that we consider in functional vision of a patient, which is what's the best corrected we can get them to see. What is the size of letter we can get them to see on the eye chart? One of the other big things that we consider with this patient population is what's called contrast sensitivity. So this is the Pelley-Robson contrast sensitivity chart. And what it is you see 3 letters at a time at a certain darkness or contrast. And so we're measuring the last of those triplets that the patient's able to see. What this amounts to outside of the exam room is if a patient has something that they're trying to view that, let's say, is really dark black on a white background, then that's ideal contrast. So they may be able to see that at their visual acuity level that we measure in the office. If it's something that has poor contrast, so let's say a newspaper where it's basically gray print on a gray background, then the contrast is going to be poor. So even if the patient's able to technically see that size of letter, they now may not be able to read the newspaper or mail that comes to them because the contrast is poor. When a patient has difficulty with contrast sensitivity, then we start thinking about strategies that we can do to help them out. One of the easiest things has to do with appropriate task lighting. So if the patient's trying to read something, then we would like task lighting that is what we call direct and contained. So something that's going to come kind of over the shoulder and project directly onto the material that they're trying to read, not a traditional lamp where the light is going to escape out of the top of the shade and underneath and cast shadows on whatever it is they're trying to see. If we can get an enhancement in the contrast, then we almost get a magnification bump, so it becomes easier for the patient to see even though the size hasn't changed. So lighting is one of the big things that we talk about. There are also types of magnification devices, particularly digital devices such as CCTVs, that will allow an individual to change contrast as well as magnify the image. So they may be able to change something that is blue ink or red ink into a black ink on a white background appearance, or they can do reverse contrast, which is white writing on a black background. When we talk about glare sensitivity, there are 2 types of glare sensitivity. One of those is what we call disability glare, and then there's discomfort glare. So disability glare is what we've all experienced if we're, say, driving through a tunnel and you're in the dark and then you emerge into the sunlight and it is literally blinding to you in those moments. It can also be things for these patients like flickering light through trees. So you're driving down the interstate and the sunlight's flickering through the trees as you go along and it becomes blinding to them. It basically washes out the vision to where you can't see well. Discomfort glare sensitivity is going to be where it's just uncomfortable. So these are usually the people that are going to prefer wearing a hat or a sun visor or sunglasses all the time, even if they're indoors. Thankfully, we have certain absorptive filters that are really excellent at helping with the discomfort and the disability glare sensitivity. So these absorptive filters essentially filter out certain wavelengths of light and allow other wavelengths through, and then we can control the transmission of the light, so we can allow more or less light to come through. So let's say we have somebody who's really, really glare sensitive, then we might put them in a dark gray filter where they're not going to get much light out at all, versus somebody who has a little bit of indoor glare sensitivity. Then we might choose something like a plum filter where they can still see really well when they're inside. They can see all the detail and contrast they need to, but they eliminate the glare perhaps coming in from the sunlight and the windows, things like that. Glare sensitivity is also really common to see in the traumatic brain injury population. And so topaz filters are an example of one that are often preferred in this population. And so we may wear these filters indoors, outdoors, or both. And so this is going to help cut the particular glare for these patients. Another time that glare can be an issue is going to be in nighttime driving. So when we talk about night driving, of course, we lose what's called the peripheral lock. So during the daytime, we're driving around, we can see what's directly in front of us, but we also have a lot of peripheral visual information as well. When it becomes dark at night, of course, we lose that peripheral or side vision. We don't have any input there. What we have is just what is directly in front of us. So it becomes particularly disorienting for patients when they're driving and then they say have headlights coming toward them. So a lot of patients will like to wear something like this filter when they're night driving. So this one is specifically made for that, and it is a light yellow filter that has an anti-reflective coating on it. So this can be very beneficial because it helps them not be as affected by the glare of oncoming headlights or street lights and things like that. So we also don't get as much of the starburst and halo effect when we're driving.